pharmacist groups are sounding the alarm over a record prescription drug shortage. The American Society of Health System Pharmacists says more than 300 drugs are in short supply, including some chemotherapy drugs. That is the highest number of shortages since tracking began in 2001. Manufacturers say a lack of raw materials is a big part of the problem. Joining us now is Dr. Scott Hadland, Chief of Adolescent and Young Adult Medicine at Mass General for Children. Hi, Doctor. Thanks for joining us.
Thanks for having me.
All right, Dr. Hadland, so there are many different types of medications that are in short supply right now. So which ones do your patients need, but they can't find right now? What do you find most impactful on this list?
Right, these medication shortages have been really frustrating and have been going on for years now, particularly since the start of COVID. The most common medication that we're struggling to find for our patients are the stimulant medications used to treat ADHD. So this includes medications like Ritalin or Adderall, medications that kids really need to be able to engage and learn in the classroom when they have ADHD. But even other medications have been impacted. I'm thinking about Tylenol and the big shortage that we had of that a couple of years ago. Amoxicillin, a really common antibiotic used to treat a ton of pediatric infections, also difficult to come across. And then, of course, there are other medications that have become really popular, including medications like Wegovy, Ozempic, and Zepbound, which are medications used to treat obesity and diabetes. These have also become really difficult to locate because they're in such high demand right now.
Yeah, with the kids, I've run into that amoxicillin problem, and it's just calling pharmacy after pharmacy after pharmacy. I mean, so in general, what do you tell your patients to do?
Well, so I think you just hit on something. You can do things by talking to your pharmacy, and you can also talk to your doctor. So when you talk to your pharmacy, let's say that you call your pharmacy or you show up and they say, hey, the medication isn't in stock. Ask them when they think they're going to get it in stock. And if they don't have a good answer for that, ask them if they can check a nearby pharmacy within that same chain, because usually they can check the supplies of neighboring pharmacies within that same brand chain to see if they have it in stock. You can also think about going to a different retail pharmacy. Often people will go to CVS, you can try Walgreens or Rite Aid. And remember too, here in Massachusetts, we have a lot of smaller independent pharmacies that often have fantastic service and really good supplies of medications. So you should talk to the pharmacy, but then you can also talk to your doctor because there are alternatives for some medications. In the case of amoxicillin, there are other antibiotics that often can be a substitute, and your doctor can help sort that through with you. In the case of ADHD medications, sometimes it's a simple switch of, instead of going with the brand name medication, going with the generic or the other way around, and having the doctor rewrite the prescription. But I just want to empathize with families because I know how difficult this has been. I've experienced it as a patient, as a father, and I live it as a pediatrician.
All right, Dr. Scott Hadland with Mass General for Children. Thanks so much, Dr. Hadland. We appreciate it.